Shoulder pain can impact all of us, old or young, but there's several options to treat it, like the reliable physical therapy and some newer methods. We'll share what those are in just a minute. Being Well is next.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for Being Well. I'm your host, Lacey Spence, and today we are talking about having the weight of the world on your shoulders. Just kidding. We've got Dr. Jeremy Stevens here from Sarah Bush Lincoln, orthopedic surgeon. How are you today?
Good, thank you.
Thank you so much for being here. And we are welcoming you back to the show. It's been kind of a bit. So for our viewers at home who maybe aren't remembering who you are, why did you get into this?
So I originally started in computer science, and I was in college, and I started questioning my decision. I decided maybe I didn't want to spend my entire life in front of a computer. And I was looking around thinking about other options, and I actually saw a knee replacement on TV, and I thought, I like that, and maybe I want to be a surgeon. So I kind of changed focus, went through the whole process, got into medical school, and then when I got to surgery, I realized it wasn't surgery specifically that I like. It was sort of orthopedic surgery, which is a subset where it's dealing with the bones and the joints. It's kind of a little more like carpentry, and that really appealed to me, where we have these problems and we fix it. It's a very kind of hands-on, direct specialty.
And so as we're talking about the shoulder today, you and I were talking backstage that there are different ailments for the different ages. So if we're starting off with our younger patients, what kind of shoulder issues do they see?
Right, so the first kind of the youngest people we see with shoulder pathology are usually little kids who fell off the monkey bars and fractured their humerus. Luckily, that's usually just treated in a sling for a few weeks. Kids have tremendous healing potential. And even if the bone is a little bit crooked, it can kind of grow straight. They have what we call remodeling potential. So luckily, in the youngest age group, it's almost never surgical. It's just a few weeks in a, not a cast, but like a sling. And those children do fine.
Which is probably for the best, because they're the hardest group to get them to stay still and heal.
It can be hard.
And so as we age up a little bit, that next kind of age group, what do we normally see?
So the next one we start to see are usually related to sports or activities. Classically you see like kids who are pitching, in overhead activities like pitching. The boys will sometimes they'll start to have shoulder pain, and then over time that can develop into problems with their labrum, which is that kind of the cartilage in the shoulder. We see sometimes in girls who are doing like overhead hitting, like in tennis or volleyball, if their shoulder's a little bit loose jointed, that can kind of slip out of place with those activities, they get this thing called multidirectional instability. That's usually treated with therapy to kind of strengthen the muscles that stabilize the shoulder. And then the more extreme of that is people who have their shoulder dislocate. We see sometimes girls who, if they're loose jointed or lax, their shoulder can kind of slip all the way out of place. That's, again, not usually a surgery. It's usually just therapy and obviously mechanics if they're having a problem with their sport. We also see sometimes people who have a normal shoulder but just suffer a trauma, like they're playing contact sport or have their arm pulled in a way and dislocate their shoulder. Unfortunately, if a young person dislocates their shoulder, a lot of times they tear the labrum, which is kind of the cartilage that stabilizes the shoulder. And so they can unfortunately become recurrently unstable. They can have that shoulder pop out over and over again. Those people usually do require surgery to go and repair that labrum so their shoulder will be stable.
And you kind of hit on it, but there is a difference between boys and girls when it comes to the flexibility.
I realized I said that. It sounded kind of sexist. I mean, obviously everyone's different, but in general, we see more of these problems of kind of loose jointed laxity of the joint in girls. There's a subset of girls whose shoulders kind of can slip around. Like I said, it's called multidirectional instability. You can see that in boys too, but it's just not as common. And then the traumatic ones, the traumatic dislocations we see obviously more in contact collision sports, which is usually more the boys.
And so if we're slipping a little bit older, above that sports age, what would the typical adults see?
Yeah, so in adulthood, like as people start to head into like the maybe late 30s, 40s, we start to see people having pain in their shoulder with overhead activities. The kind of lay public will call that bursitis or tendonitis. The medical community, we have this name for that called impingement syndrome. It's the idea that, you know, below the bone of your acromion, there's a space, a bursa, and if you're doing a lot of overhead activities, if that kind of gets pinched or irritated, you can get inflammation of your bursa. Sometimes if you just rest it and take anti-inflammatory medicines, that'll kind of quiet down. Occasionally we'll give people an injection like a cortisone shot that gives them a few months of relief. It also kind of proves the diagnosis. You know, if we give someone a shot into their bursa and their pain gets better, then you've kind of proven that's where it's coming from.
So it could be something as simple as trying to reach that thing in the top shelf, or...
Yeah, I mean, we classically, you think it's related to sort of overhead activities or being in a certain posture, although sometimes people come in and they don't know why they have it, they just got it.
They've just maybe always dealt with it.
Yeah, and I also think that it sounds bad, but as you get a little bit older, some of these things just happen even if you're not doing anything, you know, different than you used to do.
And so for that oldest age group, is there anything new that pops up, or it's just regular wear and tear?
Well, if it's just bursitis or tendonitis, like I said, we treat it with injections or things like that. There's a subset of this condition where the people kind of lose motion. They get what's called frozen shoulder. That's not really well understood, and sometimes there's no trauma or anything, but the person will just gradually kind of lose motion in their shoulder. We typically, you know, send people to therapy for that. The good news about that is it's usually, even though it can drag on for a few months, it's usually self-limited. Like people usually kind of just, it freezes, but then it kind of thaws and people regain their motion.
Very interesting. And so for that, would you just still treat it with anti-inflammatories, or is there another route?
You could try anti-inflammatory medicines, you could try injections. We almost always send people to therapy to try to loosen it up. The funny thing about that condition, though, is it seems to kind of follow its own time course. Like almost always it'll resolve, but sometimes it seems like it just kind of goes away on its own. Like the person maybe tries this or that, it doesn't work, they go to therapy, it doesn't really help, but then eventually you see them, you know, 5-6 months later, and they say, yeah, it just loosened up, they can move their shoulder. It's not really very well understood, that condition. It's that frozen shoulder.
And so you brought a model with you today. Is there anything specific you'd like to show us with that?
Well, this is just a model of a shoulder replacement, which I
Okay.
guess leads us into that kind of the oldest age group. What we start to see into like 50s and 60s, we see people who have tears of the rotator cuff, so the muscles that kind of help raise up your arm. They can little by little fray, and if they completely tear, the person will have pain and maybe not even be able to raise up their arm overhead. That's often, unfortunately, needs to be surgically corrected. We have to go in there and kind of anchor down that tendon. And then in the sort of the latest age group that we see are people who start to have arthritis of the shoulder, of the actual ball and socket joint. Just the same way you can have arthritis in your knee or your hip, you can have arthritis in the ball and socket joint of your shoulder, which can be treated with injections, and some people can decide to just live with it. But a lot of times what we'll do is we'll go in there and do a surgery where we kind of resurface the end of the bone with a ball that's metal, and then the socket we put like a nice smooth shiny piece of plastic so that becomes that new cartilage. So when they move that shoulder around, instead of grinding bone on bone, it's nice and smooth. So it gives them pain relief.
About how long does that last?
The shoulder replacements, you know, the limiting factor is probably the plastic in there that wears out little by little. But we think the plastics are becoming more durable. We're hoping people get 20 years out of them.
20 years, that would be great.
But we don't give a warranty.
Yeah. And what are the other options for treating shoulder injuries?
So it kind of depends on, obviously, like which condition, what the treatment options would be.
Okay.
If these rotator cuff tears, if they're partial thickness tears, they can heal if they're, you give rest and time. If it's a complete tear where it's disrupted, then it probably won't heal. Depending on the age of the person, the activity of the person, we don't always do surgery. You know, if somebody's, you know, older and very low demand, then maybe it doesn't make sense to do a big surgery and go through the recovery. The classic case, though, where we see someone, late 50s, early 60s that has a complete rotator cuff tear, I almost always recommend they get it fixed, because if you don't, they'll have permanent, pain and weakness, and little by little you also start to develop a kind of arthritis in the shoulder related to having the tear.
And physical therapy, is that all ages, typically younger?
Yeah, so obviously depending on the condition, some of these things are more responsive to therapy and some of the things are less responsive. In the younger age group, when people are doing sports, obviously if they're a pitcher, if they get their mechanics worked out better, if it's someone whose shoulder when they're younger is loose and slipping around, if they do the exercises to strengthen the shoulder stabilizers, that'll definitely help. In the middle age, when it starts to be bursitis or tendonitis, obviously you can try to modify activities that may or may not help. When it starts to be like rotator cuff tears and arthritis, unfortunately that starts to be more structural, and there's probably less that the therapy is going to do to sort of correct it. You obviously, if you have a surgery, then you're going to need a lot of therapy after to recover from the surgery, but sort of in general, the younger you are, the more likely the things you have are going to respond to sort of therapy and treatments and can be treated conservatively. The problems that we see in older adults are unfortunately more likely to be surgical.
And so when you've got patients who are maybe a little bit stubborn, what do you do when you're trying to prescribe that rest and they just want to keep going?
Yeah, I mean, fortunately, it's usually not dangerous for the person to kind of continue. Mm-hmm. If they can tolerate, if the inconvenience of the pain isn't so bad, if they want to continue in a sport or an activity, they usually can do it safely. The problem is, if it's an overuse kind of injury, if they keep, if they don't change their activity, I guess it's that old expression: if nothing changes, nothing changes, right? If you keep doing the same thing, you're going to keep having that kind of flare up and bother you.
And so this year has been insanely different with our pandemic, and one of the things we've all noticed, sports have really shut down. Do you foresee maybe more injuries if folks haven't been keeping with their regular conditioning and training?
Yeah, I mean, if people try to go back without sort of going back in a progressive fashion, I think that could definitely be an issue. I also think there's a big question in the community about how we like, especially with the kids, how they can go back safely. I don't know that it's really that worked out at this point, because some of the things that we do, social distancing and wearing masks, I mean, those make sense in settings like this when you're interacting with people, mm-hmm. maybe even in a classroom. It's hard to know if how you're going to be able to do that with certain activities like sports, like and obviously each sport is different. In tennis, maybe you can do that because you're across the court from the person, and if
Sure.
you kind of keep track of the balls and which balls you're using. Sports like basketball, where you're sort of right next to each other, it's going to be a little bit harder to know whether that can really be done safely.
And we're taping this in the end of June, so we'll see how the folks that make those decisions end up working that out. For our younger athletes out there, are there ways that they can prevent shoulder problems?
Right. Yeah. So, like I said before, it depends specifically on the problem. So, the classic one that we see is pitchers who start to have shoulder pain. Usually, what's happening there is they're developing contracture of that posterior capsule. So there's obviously they should work on their mechanics, make sure they're throwing the right way. Mm-hmm. They should work on stretches. There's stretches that stretch the back of the shoulder, these posterior capsular stretches. We think if you kind of keep your shoulder loose in the back, you're less likely to develop that labral tear, in later life. And obviously in pitching, it's very important to follow the pitch count. They're really supposed to only throw so many days a week or so many total throws. And at each, there are guidelines at each stage of development of like how many pitches you should be throwing, and also what kind of pitches, like at what age you should start throwing change-ups and things like that. So in pitching, there's that thing. In some of the other sports, like overhead hitting, like I was talking about, like volleyball and tennis, I think a lot of it is just having a routine that you strengthen those muscles that stabilize the shoulder. There's this idea that if the muscles that kind of stabilize your shoulder are strong, you'll have less of that slipping problem and have less of that symptomatic instability.
And a lot of what you've been talking about has just been a single shoulder.
Mm-hmm.
Are there instances where folks kind of wear out both shoulders at once?
Yeah, I mean, it's funny that whatever risk factor you have to have arthritis, say in your right shoulder, you have it in your left, except for the fact that there's a hand dominance. Typically, what people will come in is they'll be more symptomatic on their dominant side, and it's mostly just because they're using that side more.
And we haven't really hit on it, maybe weightlifters or swimmers. Do they have a whole slew of problems as well?
Right. So swimmers kind of fall under that same category as like overhead hitters, especially depending on the strokes that they're doing, butterfly or Australian crawl. they'll have that same instability of the shoulder problem, and so it's usually shoulder stabilizing exercises. Weightlifters have kind of a specific they're putting more stress on their shoulder, especially that AC joint, where your collarbone meets your acromion. There's a joint there that they're putting a lot more stress across than most people do. They can get a little bit of irritation of that joint, and there's this thing called distal clavicle osteolysis they can get.
Whew.
where the clavicle starts to kind of erode away a little bit. You can give people an injection there as like a diagnostic test. So if you give them a shot into that AC joint and the pain goes away, you've at least proven that's where it's coming from. That one unfortunately heads a little bit into what you were talking about, where people, you tell them if you kind of scale back on the weightlifting, that would feel better, but a lot of times people aren't really willing to do that. I usually let people continue if they want to, but they just kind of have to face the symptoms. There is a surgery to go in there and sort of to resect the very end of the clavicle where it's rubbing, but that's really, I'd say, kind of a rarity. Most of these things are treated conservatively.
And so if you're letting me go back to my sport, at what point have I messed my body up so much that I need more than just an injection? Is it based on pain or?
Yeah, I mean, it's based on your pathology, which is hard to figure out. In the younger people, the X-rays usually don't show much of anything. Obviously, if you get older, you can see like spurring and arthritic kind of changes. In that, the people that we mostly see, like in the 40s and 50s, the X-rays are actually pretty normal. The only way to really know if you have kind of structural tears and things like that would be to do an MRI.
So are there other random causes of shoulder issues, whether it be that purse that's too heavy or maybe sleeping on it wrong? Can you talk about any of those?
Yeah, well, there's all kinds of things we always worry about. Some of the ones that medical doctors are fearful of are things like, a tumor in the upper lobe of your lung can refer as shoulder pain, so people can have what's called a Pancoast tumor. Luckily, we don't see that very often.
Yeah.
You can have, chest pain, like of a heart attack can radiate to one of the shoulders. So like people have been seen in the ER for shoulder pain, and it turns out that they're having actually a problem with their heart. Purses I do think can cause shoulder pain. We see more kind of back scapular pain with that.
Just had to ask for us heavy purse folks. So what does recovery time look like on some of your most common procedures?
Right, so it depends on the procedure, but labral tears, which are done in a little bit younger people, usually people recover faster, maybe 3-4 months. Rotator cuffs are probably 5-6 months, and then I'd say shoulder replacements at least that. If we actually have to replace the shoulder, and the shoulder is kind of notorious for being kind of a slow healer. Partially because most of the procedures to get in the shoulder, like if we do like say a shoulder replacement, we have to kind of release the rotator cuff and then repair it. So we have to protect that to heal. So typically people are in a sling for 4 or 5 weeks before they start therapy.
And I assume there's like weight restrictions and things with that?
Yeah, obviously people are non-weight bearing. They can't really put any weight through their arm at the beginning. People have rotator cuff tears, which is probably the most common thing that we're doing. They have to wear that sling for 4 weeks, and then they're really not allowed to actively raise up their arm on their own, for the next month or so after that. So, they're not really even raising up their arm on their own until about 2 months. So that's why it's such a long process.
And so you're hand me this, hand me that, because I can't get it myself.
Yeah, you definitely need help.
And so as we work towards the future, are there any new things or advances in treating these scenarios?
Yeah, I think, in terms of traditional orthopedics, the procedures are always getting better. It used to be that if you had a rotator cuff tear that was too retracted and sort of too chronic, where it was sort of pulled back too far away from the bone, there was no way to bring it back, so it would be what we call irreparable. Now we go in there and put a graft in place of that to sort of take the place of your rotator cuff. That's called superior capsular reconstruction. Actually, I'm on the lookout for people who need that procedure. I also think that there was a time if you had a torn rotator cuff and you were older and you had a kind of arthritis, you couldn't really have a shoulder replacement that would function very well because it required your rotator cuff to work. Now there's been a kind of a new advance where it's called a reverse shoulder, where the ball is sort of put on the socket side and the socket's put on the ball side, and people are able to raise up their shoulder even if they don't have, even if the rotator cuff isn't working. So that's the traditional sort of advances. There's also this kind of movement toward the biologics, which I think is actually the future of orthopedics. I mean, someday we're going to know how to sort of activate these signaling pathways to, stimulate stem cells to sort of grow cartilage, or, like instead of like right now we're replacing people's shoulders. I think someday we'll be able to give people injections and activate these stem cells to maybe regrow new cartilage. that unfortunately isn't really worked out that well yet. Those signaling pathways aren't well understood. It's also problematic in the sense that a lot of insurances don't yet pay for some of those more biologic procedures because they haven't really been, borne out with studies and time.
And so with any procedure, you're kind of rolling the dice, but especially with those, since it's so new, it could kind of go either way.
Yeah, I think that it's a twofold problem. One is that we don't really think we have the science worked out yet, and two, right now the payers aren't really on board to pay for those newer procedures, which might be prudent. Maybe they don't want to encourage people to have these procedures until we know that they really work and that we've got the science down.
But it's great that you've got these other advances where you're still able to cast that net a little bit wider and serve more patients.
Yeah, definitely there are less people that are stuck with these diagnoses where there are no options. I think it used to be, like I said, if you had an irreparable rotator cuff tear, it was just irreparable, or if you had a bad shoulder, bad arthritis, and no functioning rotator cuff, there were very few kind of good bailouts. Now, really, no matter what the condition, there's at least some kind of an option for you.
For our area, do you notice yourself seeing certain types of problems more than others?
Well, I definitely think a lot of kids participate in sports around here. Probably more. I was in Massachusetts in my job before this, and I think this area, I think kids are really concentrated in sports, which is good. I also think maybe some of the kids are playing sports kind of year round and not getting that rest. So we see sometimes I think we see a little bit of overuse problems that could be prevented if people kind of took that season, like if they played in season but then had an off season to kind of recover and rest. It's interesting if you look at where most of the starting pitchers in baseball in later life come from. They come from a lot of cold weather climates because in the warm weather, kids are pitching year round and they kind of burn out their shoulder. They kind of wear it out. So kids probably need that time off to rest and recover.
So you're talking about the folks, like maybe it's girls do softball in the summer and then they're doing basketball in the fall and then volleyball in the spring.
Yeah, that would be one thing, and that's where the person's playing lots of different sports. Mm-hmm. We're also seeing, unfortunately, kids who play the same sport all year round, like on traveling teams,
okay.
So they don't really get a chance to rest really at all.
And then we also have a lot of farming folk in our area. Are there any injuries that target them as well?
Well, there can be these catastrophic farming injuries, unfortunately. Luckily, that's not what I focus on that much, but we definitely do see sometimes very serious injuries from farm implementation.
And so if there's people at home who are struggling with pain, at what point do they need to see their doctor about it, or, instead of using the anti-inflammatory?
Yeah, so, I think if you have a few weeks of shoulder pain and if you take, Advil or Aleve a couple times a day for a week or 10 days, if it starts to be, it's a month or 6 weeks later and it's not getting better, then you probably would want to see your primary care physician. I do think that one of the things that I see sometimes is people come in who have a rotator cuff tear, but we realize it's chronic, that they've had it for probably, 6, 7, 8 years, and it's now irreparable. And, that's the person that we wish we had seen, a little bit earlier in their course, because we probably could have done a primary repair.
And is that kind of a big thing that you see where there are people who they could have had a way better chance of recovery? Do you see that in all ages? Is it just older people that you catch?
Yeah, it's funny, like younger people, there's a lot of advantages to youth, and one of them is almost anything that's wrong with the shoulder when they're really young, they can kind of recover from an injury. Mm-hmm. It's sort of that when it's that person who's like 45 when they tear their rotator cuff, but they never really seek treatment. And then we see them when they're 55, and now they're starting to get arthritis of the shoulder, and the rotator cuff is irreparable. That's the patient that we wish had come in a little bit earlier. Yeah.
Are there any cases that stick out in your mind that have just been miraculous healing?
Well, I kind of alluded to it. I'm kind of on the lookout for people who have these irreparable rotator cuff tears, because we've seen a lot of these people who 8, 9, 10 years ago were told they had a tear that's irreparable, mm-hmm. and we started to go in there and put this graft in place of in place of their rotator cuff. It's called superior capsular reconstruction, and people regain, they have a lot less pain and they can regain overhead motion. So it's not a miracle, but it's pretty close. People are very happy, and it's funny that these are people who had sought care, and at the time medicine really wasn't ready for them. We didn't have a solution for them, so we said, well, it's not repairable, you have to kind of live with it. Now we're telling people they don't have to. We at least have an option if they're interested.
And then in our last minute here, if I'm looking to seek you for advice on my shoulder? Do I need to have a referral or anything like that?
It depends a little bit on your insurance, obviously, but in general, no. If you just call Sarah Bush Lincoln the medical center, and they'll direct you to the orthopedic clinic, and you can usually just schedule an appointment on your own.
Excellent. Dr. Stevens, thank you so much for being here.
Thank you.
And thank you for joining us for Being Well. We will see you next time.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.